My name is Sean Burns. My specialty is orthopedic trauma, but more often than not, I actually do knee and hip replacements. So education, well, I went to college. Mine was at the University of Texas, Hook'em Horns. After that was at the University Medical Branch in Galveston, which was between Galveston and Houston, which has an amazing medical facility. If anyone wants to really see a giant facility, drive to Houston, the medical centers, mini hospitals that are 26 floors and above. After that, residency, or admission at UTMB, and then fellowship was in Denver at their Center for Limb Restoration, which we did bad fractures and hip and knee replacements. And I came to Concord, New Hampshire in the fall of 2012, or summer of 2012, I guess. When I was a kid, I had like a medical condition. I had to see people, and I just got like warm feelings from that, so that's why I thought I'd be a doctor. But the key issue for me was when I was in high school, I really wanted to be the team doctor for the Houston Astros, because I lived in Houston at the time. And I knew that to be the team doctor, there were a lot of orthopedists, so that's why I would be an orthopedic surgeon, even though I didn't know exactly what that was at the time. In college, I had a couple orthopedic injuries that required surgery, and I think that kind of cemented it for me. Most interesting aspect is restoration of function. Well, a lot of people we see are in terrible condition after their car accident or significant fall, and we're able to get them back to being near normal, if not normal. So to me, the most important aspect of the doctor-patient relationship is trust. It's trust that we have your best interests, they're going to help you get to a good place. The most rewarding aspect to me is when a patient, thanks us after surgery. You see them the next day in the hospital, and they're like, my pain is gone, I feel like I can do things. Or if they share an experience in the office, they'll say, I haven't been able to do X for 10 years or 20 years, whatever, and now I can do this, and it really has changed my life. Or if you give my life back, that's amazing, and it makes us feel so good to hear it. There's lots of ways to stay up to date. We get mini journals every month that you skim through. We have our big trauma meeting and joint arthroplasty or joint replacement meetings. So we do these meetings, and at these meetings, people present their new research and ideas, and that's where things come first. After the meeting, 6 months to a year later, it'll be in a journal, which I highlight to come out every month. And after that, a couple years later, it ends up in a textbook. So my main interest away from the office is obviously family, and then next to family is running. I like to get up really early in the morning and run. It's a nice thing about being in New England is that in the summer, it's daylight as early as 4 a.m., so you can get out there and get some exercise when it's nice and cool. And it's something you can do anywhere you are. So if you're at a business or family vacation, just bring some shoes with you and you go exploring. And I think that's really neat to go explore a city you've never been to.